Hi, I'm Dr. Steve Grinstead, author of the book Managing Pain and Coexisting Disorders and the developer of the Addiction-Free Pain Management System. Today I'm very excited to be at my 6th annual Addiction-Free Pain Management Center of Excellence review with Valley Forge Medical Center and Hospital. And today I have a very special guest. Tracey, introduce yourself to the viewers.
Hi, Tracey Vawter, Director of Planning at Valley Forge Medical Center.
And Tracey, how long have you been with Valley Forge?
I've been there for over 20 years.
So over 20 years. Wow, that's been a long time. So why do you do what you do? What gives you passion to do this work?
Do you know what? I believe in what we're doing at Valley Forge, and I have spoken to a lot of patients when they call for help, and they really are pretty hopeless.
Yeah.
And what I find as I tell them about the programs and what we have available is people start to get a glimmer of hope. And then when I see them go through treatment, it's really very exciting. In fact, I get goosebumps sometimes.
Very energizing.
Yeah,
and goosebumps,
absolutely,
right?
yeah. And
wow.
I see family members that are saying, "Oh, I have my son back. This is the woman I married."
Yeah.
Just really exciting results.
Yeah. So who are some of the typical people that come into your breakthrough chronic pain program?
Individuals that are having trouble with their opiate pain medications, prescribed often, but have really significant injuries.
Yeah.
And initially we had these referrals from physicians in the area, and we had put them in our addiction program, and we knew pretty quickly that that wasn't going to work, that they really had these significant, genuine pain and significant injuries and needed help finding ways to manage that pain without the use of these medications.
Right. So, I said earlier that this is my 6th review with you guys. What was it like before you started using this model at Valley Forge, and how has that changed, and how did you decide to hook up with me?
Well, again, we were putting the patients, the referrals in the addiction program, and it wasn't working very well.
Working.
Yeah, we really weren't giving them tools to help them to self-manage. So we had done some research, and that's where we came across you and your program, the Addiction-Free Pain Management Program, and we had heard that you were going to be in Philadelphia at a conference presenting, and so we sent some of our nursing staff down, and they came back very excited. And from there, the consulting and the program began. Yeah,
they were very excited. They came up to me after the presentation and says, "Can we get your card? We want to see if we can get you out to come to the hospital." And it was very exciting.
Steve, it makes sense. It just makes a lot of sense.
It made sense.
Yeah.
Okay, so what are some of the things you do in the program that you've learned by implementing this model?
I think one of the things that we do is we have a very strong cognitive behavioral component, and we certainly use your workbooks, and I think patients have really made some changes and again been able to figure out what some of their triggers are related to the pain. We do the detox process in the pain program. It's really a slower, gentler, around a 2-week detox process.
Right, so you don't push them through real fast.
No, which is different from the addiction program.
Right.
And then we have this incredible functional restoration program.
I was so excited when you guys added that this year. That is going to make a big difference.
The changes, the progress we're seeing in patients is just very exciting.
Okay. And again, let's end where we began. Why are you doing what you do?
We're seeing some great results, and I believe in the people, I believe in the patients, I believe in the staff.
Yeah. And what I see and I did the Chronic Pain Anonymous meeting this week and saw so many of your alumni there, and what they got out of your program was a freedom from suffering. And they were really telling the other new people there that were thinking about coming in how powerful that was for them, how it changed their lives. And one even says, "It saved my life."
It really is incredible. Somewhere around the 3rd week, 4th week of treatment, you see the light bulb go off, and patients realize that they can self-manage, that they can, learn to manage the pain without the pharmaceuticals.
Yeah, absolutely. And I want to remind everybody that I believe that freedom from suffering is every pain patient's right, but it's also their responsibility. So thank you very much for watching this video. And please check out Valley Forge Medical Center.